24 News Midday.
Welcome back to this Midday. October is Breast Cancer Awareness Month, and it's more important than ever for women to get tested for early detection. Now, here to tell us about a screening tool that's the first of its kind being used right here in Memphis is Rubenstein. Thank you, first off, for joining us this midday.
Thanks for having me.
Okay, first off, before we get into this piece of equipment, tell me the center that you guys work with. You just recently opened here in Memphis. Tell me about that.
Right. We brought Thermography Center of Memphis to Memphis in November of 2012, filling a void that was here, and we've been here since then.
And tell me a little bit about this kind of medical unit that you guys use to detect breast cancer. I know it's been, you were telling me before that it's been in use since 1982, but I mean, since you guys are the first center here, a lot of people may not have, ever heard of this or used this resource.
Right. We're trying to get the word out that we are here, and a lot of it is education and telling people that this is a radiation-free breast screening that is important to add to the other breast screenings out there so that we can get the full picture of what's going on with our breast health.
And when you talk about the breast screening, how is this different from the norm or what women are accustomed to, I guess you could say?
Okay, so thermography is a test of physiology. That means what's going on inside the body at a more cellular level, what's going on with the blood vessels inside the breast. Whereas other tests that we do are anatomical, where they would look at the actual tumor or the actual organ.
And I know we have a picture here of kind of what this machine does. Can you kind of describe what we're seeing here for the folks at home?
Yes, on the upper left, you see a picture of a normal breast thermogram, which shows that you could see they're both symmetrical. They look the same on both sides. And that's what doctors look for when they're looking at when they're interpreting the thermograms. And when you get to the one on the right, the second one, you see that there's changes. Both sides look very different. And this is how the doctors are able to tell that something's going on.
Yeah. So this can kind of give you a clearer picture, so to speak.
A clearer picture and a very early picture, because breast cancer cells, they double at a very quick rate. And so you can see things starting very early, because you could see that the blood vessels are increasing in that area to support a tumor, whereas it would take 8 to 10 years before you could see that same thing on a mammogram.
Yeah, and you were just, you want to stress, I guess the most important thing through this interview is just the fact that women should know the different options they have out there.
Right, and if we, if we pool all our options together and take advantage of everything that's offered to us, then we'll have the best available outcome for our breast health.
Okay, for those folks out there watching, maybe want to find out a bit more information about the center, how can they do that?
Okay, so we have a website, memphisThermography.com, and we're located at 5668 South Rex Road. You can reach us at 249-8642, that's 901, and just give us a call, and we'll answer any questions you have.
Okay, great. Well, obviously, it's great work that you guys are doing in the community. And with this being Breast Cancer Awareness Month, obviously this brings a light to this, what may be a difficult issue for some. So hopefully folks out there watching will give you guys a call.
I hope so.
All right.
Thank you so much.
We appreciate it.
Appreciate it.
We're back in a moment. Stick around.